Are you saying that the socio-economic factors or socio-economic factors precisely also, relate to, they have a connection with having stroke? Some people will say underlying ailments, one of which you mentioned, the high blood pressure. What leads to high blood pressure itself, and how long does it take for it to get to the level where one will be stroke-stricken?
There are many factors that actually lead to high blood pressure, otherwise known as hypertension. The way we live our lives, the things that we eat, and if we don't modify how we live, there are things like alcohol and drug abuse, especially among the young ones. We have young stroke, and then we have adult stroke as well. And blood pressure can also run in families. There could be a family history, which is the reason why people should find out family histories and know if it runs in families, so you can really know how to live your life and plan out your life and check that everything is optimum. And other things also like alcohol abuse, a lot of drinks. People want to hide their sorrows or the situation, let it pass, and then they drink so much, and that keeps the blood pumping. Other things could be the way we eat, bad oils, cholesterol, things like this, things that can harden the blood vessels and break out and block, the blood flow, which carries oxygen to the brain. So these are not exhaustive, but these are some of the factors that may cause stroke through high blood pressure.
That's right.
Okay, and of course, so it's basically about managing that hypertension, or
exactly.
bringing down, as much as possible your high blood pressure. Yeah, because that's the indices that, could trigger stroke.
Yes.
And then help us break down, because many people still see, okay, some people, know the symptoms of stroke, but in terms of what goes on inside of the body that, brings about stroke. There's this talk about, blood to the brain, and help us to understand, how the body behaves. It behaves the way it does when,
a stroke happens.
A stroke happens.
Right. There are two types of stroke. There's the hemorrhagic one, where the blood vessel just bursts because the pressure is too much and goes into all the vital parts of the brain. That's really pretty dangerous. And then you have the ischemic stroke, which I talked about, where a thrombus, a particle from another part of the body, from a hardened blood vessel, breaks out and travels along with the blood flow, and then causes what we call embolism, and that stops that part of the brain being supplied with blood and nutrients and oxygen. So therefore, this is what happens when a stroke happens. So when it happens, the signs that you will look for, even as a witness, is what we call be fast. Fast. F, you want to see if their face is like normal or asymmetrical or has gone to one side. A, you want to ask them to stretch their arms out and see if it's okay balancing, or if one is falling down, you know that something is not right. And then S, speech. Are they speaking properly, or is it slurred speech, or they cannot get the words out? And then T is that time. Time to call your, provider, or to go to a hospital. But I think that it is very difficult. In what I've noticed here in our country is that it is very difficult to say, call this number. For many reasons, either the ambulance, it's not there, or there's a traffic. There are so many things that we have to, take into consideration. But what I want to stress actually now is that time is brain. That's what we say. The earlier you get to the hospital, the earlier you get help, then the better you'll be in terms of making that recovery. Right.
Because you've expressed worry about people having access to emergencies,
Yes.
care
Yes.
very quickly. But what do you think are the immediate steps that one can do what moments you suspect that, oh, what is wrong with such individual is stroke, either individually or what people around the person can do in the interim?
This is why we try to create awareness. But I tell you, whatever we do is a drop in the ocean. We need more and more, not just once, twice a year, because our people think that stroke is this. We try to bust the myth within the stroke, because people think that when you have a stroke, somebody from the village done something. And people have all this myth about stroke and make it a thing that, oh, we can't tell somebody because I think that there's something evil, somebody in the family, which is not true. And the first thing they do is either to call the religious leader. It's a good thing to pray and not what you do. But I think that the first step is to try and get medical help, because the sooner you get this help, the better, because once you get into a facility that has those things that you need to do a CT scan, you need to do ECG to see if it's from the heart, you need to do MRI, and the blood, stroke-specific blood test to see if there's a problem with your clotting factor. All those things could be done straight in a hospital that deals with stroke. There are stroke-specific hospitals even here in Lagos. So if you're a witness that somebody's having a stroke, I think the first thing is to rush them to have to be checked out. And if it's within the window of 3.5 to 4 hours, they stand even up to 6 hours. They stand a very great chance of a quick recovery.
Oh, wow. So those first few hours are
very crucial.
Very crucial.
Very crucial.
But then the reality in Nigeria, as you have said, is that, these hours, are usually lost.
Yes.
Right?
Yes.
You also spoke about, stroke upon stroke earlier on. You said, because people would also need, some more clarity on that. So you are saying that there could be several episodes of stroke. Help us understand.
Definitely. Once a stroke happens, we need to have the diagnosis, what actually caused the stroke in the first place. And once that is been established, we need to treat that underlying cause, because research has shown that once somebody has a stroke, the possibility of having another stroke 1 week after, 3 months after, 5 years after, it's there, it's possible. I have seen people, they say, a case has been referred to me 2 weeks ago since I've been in Nigeria, and then the elderly man had a stroke 5 years after, had another. So he's had 3 strokes, and the third one that he's had now has actually rendered him unable to move, loss of mobility, loss of speech. He's had on both sides of the brain, both the left side and the right side. So you can imagine. So the underlying causes of stroke has to be diagnosed and treated optimally to avoid this stroke on stroke.